So how is breast cancer diagnosed? Mammographies, mammograms, number one. Ultrasounds are also very good because, as someone else mentioned, sometimes people can have things like cysts, right? And cysts and masses are different. They can usually be distinguished on an ultrasound, right? Where a cyst is a hollowed out ball, which looks very different on an ultrasound than a tumor does or a solid mass does on an ultrasound. MRI scans, like we mentioned, are especially useful for women at very high risk of breast cancer, or women, especially young women with very dense breasts, in which a mammogram might not be able to give us a complete picture or a good picture. With cancers, general rule of thumb is for the majority of cancers, and there are a couple of exceptions, but for the majority of cancers, you have to get tissue, a biopsy, in order to diagnose it. Even though there might be a very clear-cut, absolutely obvious tumor there, the only way you'll know for certain if it's a cancer in the setting of breast cancer is with a biopsy. So, and another key point is some women will come to me and they'll say, you know, I noticed this lump in my breast and my mammogram from the other month was normal. What should I do about it? If I feel a lump, and even if the mammogram is normal, I will say, if I'm suspicious, we should still get a biopsy. Because the mammogram, even though it's good, it's not perfect, like most tests, right? Sensitivity of it for picking up disease is 75 to 90%. It's not 100%. So if you feel a mass, pursue it. Make sure you bring it up to the attention of your doctor, even if your mammogram recently was normal. Make sure your doctor knows about it. The next thing to discuss is once a person says or tells a lady or sometimes a man that they have breast cancer, what do we do next, right? And the next thing to know about that we mentioned at the very beginning is staging, which is where has the cancer gone to? So staging is, simply put, a way of describing a cancer such as the size and if or where it has spread, right? We use in the cancer world a staging system called TNM. T standing for tumor, which is typically the tumor size. N standing for nodes, which is typically whether or not the lymph nodes, which everybody naturally has throughout our bodies, are affected. And M standing for metastases, whether or not the cancer has spread from that original site somewhere else in the body. Treatment, prognosis, everything will depend on a person's staging. So there is such a thing as stage 0 breast cancer, and those are the carcinomas in situ, which we mentioned at the very beginning. Non-invasive cancers are what they're called. Ductal carcinoma in situ is the most common in situ breast cancer, and like I said, it's not considered a cancer itself. Most people will consider it a pre-cancer, meaning if it's not removed, sometimes, and most often, it will become cancer. So that's why for ductal carcinoma in situ, it is important to take it out. Stage 1 breast cancer means that the tumor is relatively small in size, and it has not gone to the lymph nodes. And I'll talk about which lymph nodes they commonly go to. Stage 2 is, and it breaks it down, means that there is either a small tumor that has spread to the lymph nodes or a medium-sized tumor that has not spread to the lymph nodes, or a cancer in the lymph nodes without any evidence of cancer in the breast. So there's some distinctions. You actually don't have to memorize that or pay attention to that. Just know that the staging is based on how big the tumor is, whether or not it's gone to the lymph nodes, and finally, stage 4 is whether or not it's gone elsewhere outside of the breast. How is breast cancer treated? So I'm going to talk about just the main ways, a few words about the main ways, different modalities that breast cancer is actually treated. I'm going to mention a few things about surgery and the different types of surgery. I'm going to mention radiation and whether or not women should or should not get radiation. Chemotherapy, which women with breast cancer may or may not require. Hormonal therapy, typically in the form of hormone pills, and targeted therapies. So these are some of the treatments that are available, which some women may or may not require. Some women with an earlier breast cancer may just require surgery, and that's it. And some women, if they are advanced in age, 10 years more than, 20 years more than you, or anyone else in the crowd, then we might talk about whether or not surgery is appropriate.
You're making points. What they mean by targeted?
Targeted therapy, I'll go into it. Very specific, over the last, recently, there have been very specifically prepared types of treatment for breast cancer, which are actually excellent types of drugs that will only work for women with certain conditions. And I'll go into it. They're antibody types of treatments.
I've never heard that.
Yeah, the actual names of it are Herceptin, for example, trastuzumab, that's one of the main ones, and Avastin is another type. So, how do we make a decision as a cancer doctor what types of treatments to give, right? If at all possible, if a person offers you surgery because you have a breast cancer that has not gone anywhere distantly in the body, I would say highly recommend that you take them up on their offer for surgery. There's two main different types of surgery. One is lumpectomy, which is where they remove the tumor, and the other is called a mastectomy, where they remove the entire breast. Right? Most studies have shown that if you had an equal choice between the two, they are equally effective. Equally effective to take out just the tumor versus the entire breast, which is why in most situations, most women and doctors would prefer just to take out the tumor. Now, when they sample the tumor, it's also important to sample the lymph nodes in the armpit, right? Because that'll be the number one way we'll know and suspect if it's gone anywhere else in the body, because that's one of the first areas it goes to. From that surgery, we run the breast cancer tumor, we run several tests. Things we pay attention to which will help us to guide whether or not we do chemotherapy, hormonal therapy, targeted therapy that I'll talk about, radiation therapy include, number one, how big is the tumor, right? Number two, did it go to the lymph nodes in the armpit or not? Number three, did it go anywhere else in the body? Number four, and this is now a new topic, is whether or not it had hormonal receptors that were positive, ER, PR meaning estrogen, progesterone receptors, and the last thing is whether or not it had something called HER2/neu positive, okay? And I'll talk a little bit about that in just a moment. So these are all the things that we'll think about when we're deciding what is the best treatment for an individual person. So surgery is to remove the tumor, all right? For invasive cancer, like we mentioned, you also want to evaluate the lymph nodes. Lumpectomy versus mastectomy is a decision to be discussed with your doctor. And breast reconstruction is an option after surgery. So even women who have the entire breast removed, they can oftentimes have later on or immediately afterwards breast reconstruction, which is sometimes very important.
When you have radiation, who decides? How do you decide?
Good question. So, let's see, radiation is another slide away. Shall we wait till then? So, now what other treatments are there? We mentioned them, and now we'll get to radiation. So, the question is, when does a woman need radiation? Right? Radiation is typically given for women who get a lumpectomy as opposed to a mastectomy. If you just get the tumor removed, typically we'll give radiation there. And there are other criteria. If the tumor is very large, that might be another criteria for considering radiation therapy. So it really depends on the surgery results and what type of surgery you do. So those are considerations for radiation.
Surgery or
after? Yeah. So it's usually radiation first. And I'll sort of point out some of the differences that there might be. But typically it's radiation first. If a woman requires chemotherapy, which I'll talk about in just a moment, then we'll do chemotherapy next. And then after chemotherapy, we'll typically do radiation therapy, and then if they need to, hormonal therapy. So if you required all those treatments, that was typically how it would go. If you just required the surgery and the radiation, it would be surgery followed by radiation.